views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure and privilege to welcome Dr. Marie Smith East, Director of Psychiatric Mental Health Nurse Practitioner Program and Clinical Assistant Professor at Duquesne University School of Nursing. Marie, welcome to the program.
Oh, thank you so much for having me.
Our pleasure, my pleasure. So I know you're doing a lot of cutting edge work to promote mental health and provide mental health services to students and populations generally, particularly during the enormous stress associated with the pandemic. Tell us a little bit about your work.
Correct. So I actually just presented on my practice. So I run my own telemedicine practice that I've had even before the pandemic started. So it was great to have a little bit of information concerning my practice even before the pandemic started in terms of quality indicators. And then after the pandemic, well, we're still in the middle of it, but just information once the pandemic started going and a lot more people were socially isolating at home and seeking care online. So one of the benefits I would say of having that opportunity to have my own telemedicine practice and also be a researcher and access to care is just seeing how this unfolds like in real life. So what's been really interesting, I just published a paper on access to care, what that really means, because I think access is such a buzzword. And so even within my research, it talks about what that actually entails and how that really was very applicable even to my telemedicine practice, even after that was published. So the focus really is on the ability to provide quality care, connectedness, not just in terms of technology, but also being able to feel as if that population belongs to a particular group, that their clinician is listening to them and taking the time, and just the state of being connected to services as well. And then I also published a paper in regards to access to care, or inadequate access to care in relationship to children as well. So I would say my research mostly focuses on all of the sociodemographic factors as well that are associated with access to care, what access means, and how we can improve quality of care.
So that's great. One question I have is, what is your sense? Is there data on the degree to which, it's a two-part question, that telemedicine, which has been around for a long time, I mean, it certainly predated the pandemic, to what extent does that provide additional access to care that maybe didn't exist without telemedicine? And is there any data on the effectiveness of telemedicine as opposed to in-person?
Okay, very good questions. So let's start with the first question. So additional access. I have been very blessed to be able to provide care in states that are outside of my own. So I'm currently located in Florida, and I see patients in Arizona. I see patients in Iowa. I see patients in Pennsylvania. I see patients in Florida as well that aren't even located exactly where I'm located as well, in rural areas. So it definitely expands additional access. I just contributed a blurb to a publication as well in regards to providing care for BIPOC communities, so people of color. And how that can expand access as well, because maybe they didn't have a provider that they felt that they could see that looked like them, or they felt more comfortable seeing that looked like them. It expands that access of where they can actually connect with those providers. At least that's what I have been seeing. But the research does support that even during the pandemic, that patients are reporting that the convenience of having the ability to speak with their providers, sometimes they even say that they feel that the care is even more better than what they were seeing even in person. And again, I think that also varies too in terms of the demographics as well. So older people might say that they prefer to be in person, and it depends also on their condition. So certain conditions, it would be better to be seen in person. But in terms of mental health, it actually reduces a lot of the stigma. So if I were going into a clinic that was labeled community mental health center, they can kind of dodge having to go into that clinic where maybe some of their neighbors or people within their community might see them. So it kind of helps with lessening that. And I know that even integrated care helps with that too. So even using an integrated care model that also utilizes telehealth is helpful, because you can hire providers that are mental health consultants, clinicians, and that can be very helpful.
And so you alluded to that. That makes a lot of sense. I'm wondering, do you run into any? Well, actually, let's stick with the second question. Is there any data on the efficacy of a telemedicine approach versus an in-person? You alluded to with
Yes.
potentially older populations that they prefer the in-person.
Yes.
Is there, and by the way, just for the record, like on the few occasions I've done telemedicine for myself or my family, it's like a blessing in terms of just the hassle factor.
Yeah.
But is there any actual data about efficacy, particularly with respect to mental health issues, where maybe it's an ongoing, weekly session on dysthymia or depression or anxiety? Is there any data on telemedicine versus in person?
Yes, for mental health specifically, they've seen improvement in adherence to care. So they've seen less no-shows. I think the biggest issue that they'll see is usually just related to the technology and how we can overcome any obstacles or challenges in terms of technology, in terms of the internet connection. If the internet connection does fail, what is the backup plan? And a lot of agencies have guidelines or are now working on guidelines to help with that process. But that's basically what it alludes to, that it's either on par or even exceeds what you would probably see in person for the mental health population, with the exception of issues that patients or participants in those studies were reporting in regards to technology, whether they felt that they weren't trained on the technology. And again, agencies try to overcome that by possibly having like a few minutes set aside to make sure that it's prepared, or sending them a link, telling them the instructions on how to connect, and making sure that that's set up before they actually connect with their provider. And I think that might make a little bit more sense too. If an older person is like, I'm not really comfortable with technology, I feel more connected when I'm meeting with someone in person. That makes sense as well. So yes, there is literature to support that, at least current literature that's supporting that.
That's very helpful. I mean, if it is indeed true that attendance compliance is equal to or greater than that would be a huge benefit all by itself.
Correct.
I think part of the challenge of any health provision is knowing what you don't know, and which is sometimes difficult, if not impossible. It seems to me that what I don't know here is what percentage of low-income populations of any race or demographic have access to the technology and the savvy to use it to access the service. Is there any concern about that?
Yes, so that was actually what my other publication that I did for the Journal of Child and Adolescent Psychiatry journal. Basically, that's what I talk about with a colleague of mine, Dr. Shakita Starks. We explore that. We look and see what is in the literature in regards to access to care, specifically for children with inadequate access to the internet, and what those solutions were. So there is a percentage of patients, and again, we only looked at children or children and adolescents. There is a percentage of low income or just in general overall that don't have adequate access to internet. However, there was also in the same sense literature that supported different solutions. So that would include whether they would have access through their school or access through the public library. There were different solutions that were currently available. And then now, even since that publication, I know that the current administration has also provided incentives where people can get discounts for their internet service, just relationship, because we were socially isolating. So again, my research was before that even came out. So I would be curious to see if the numbers have changed since then in terms of that small population that were experiencing issues with inadequate access. But then also there were even more solutions that other countries have used, not just for children, but also for adults. So for example, there's a mobile bus that they use, I believe in India, where the patient would come on to the mobile bus. They would speak with someone through telemedicine, a clinician through telemedicine. If there were any medications that were prescribed, they can fill that medication on the bus. There's a pharmacy on the bus as well. And then they would be able to come off. So they actually come to them and provide that care. So it's really interesting to see what different options. I think that the pandemic really has forced us to kind of think outside the box in how to provide care.
Sounds great. Sounds like very useful and important work. We're going to take a quick break. When we come back, Dr. Marie Smith East is going to talk a little bit about her own experience and educational history that led her and provided the opportunity to have the excellent career that she has today. This is Public Health America. I'm Dr. William Latimer. See you in a minute.
Built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So Marie, at this segment, this part of the segment, I always open with the same question. Where were you born and what were some of your formative experiences?
Right. So I was actually born in North Miami, Florida. I went to public schools. I went to private school probably for kindergarten, for just kindergarten. But then after that, I went to public school throughout my whole formative years. So for elementary school, middle school, high school. And by the time I got to middle school, I was in a magnet program that my school provided. It was for technology, computer technology. So that's really where I learned how to type really fast. They would literally put a folder over your hands and you'd have to type without looking down, which is so helpful now. You know, a lot of work is done on the computer. And then even in my high school, I went to a science magnet school, but it was still a public school. And just by magnet school, I don't know if it's the same verbiage it's used across state lines or nationally or whatever, but basically it's a program that is geared towards some type of specialty area. So in middle school, it was computer technology. And then when I went to high school, it was a bioscience type of program. So I would say that throughout my formative career, I was never the student that it was so easy to study. I always had to read things 4, 5, 6 times before I got it. I always felt like wasn't the best test taker. I always had to work. I've always felt like I had to work a little bit harder than maybe the average person or how I perceived the average person was working. And all throughout my schooling, I always felt like you come across professors or you come across a teacher that really made a difference in your life, right? That encouraged you to do the best that you could. And then there's also those that will kind of discourage you along, like, oh, this isn't great, or you can't do this, you can't do that. So I would say throughout my whole career, I've focused on whenever someone tells me I couldn't do something, it pushed me that much more to actually accomplish it. And it wasn't that I wasn't born with like a silver spoon in my mouth at all. My mother was a nurse, an emergency room nurse. She recently passed from sickle cell anemia this past December. So that was quite a blow.
I'm sorry.
Yes, thank you. And my grandmother, who's my mom's mom, who outlived her, she's also a nurse as well, retired, but she worked in midwifery. So it's really funny that I even ended up in nursing. You would think, hey, I'm now the third generation of nurses, but I just wanted to get hands-on experience. So even when I got out of school, my first thing, I went and did EMT school. I worked on an ambulance. I guess it's a fun fact. And one of my paramedic friends said, hey, you should do nursing, which is funny because, like I said, there's a history of nursing in my family. But my mom always worked really hard. My grandparents always worked really hard, but they were very giving. So we spent a lot of time volunteering in neighborhoods. It's very humbling, and sharing stories, motivating each other. And I still do that till this day. I still volunteer for the Salvation Army. I still ring bells. And I just am so grateful for all the opportunities that people invested, whether it was because I applied for scholarships. Fun fact, my high school provided a lot of scholarships, and I noticed that my colleagues or my peers weren't applying for the scholarships. And I mean, these are local scholarships. So it was really easy kind of to get because I wasn't really competing too much with other people. I guess they would argue that, hey, you're a good student, for the most part. So of course you got those scholarships, but I did that. I went for my local scholarships that my school would post. We had like an office that they would post scholarships that are currently available. I applied for all of them. And even when I graduated from high school, I wanted to go like to the University of Miami. I was like, I want to go to the University of Miami. I grew up there, go Hurricanes, all of that. And all of my scholarships could not afford the private tuition, even though I had a ton of scholarships. So I ended up going to the University of Florida. Not that that's a bad thing at all, right? University of Florida, go Gators. And my whole tuition was covered because I had gotten all of those scholarships in high school. So I was able to go to school there. And then later on in my career, because I actually did I did health education behavior, got to do a lot of cool things with the American Cancer Society. And then when I decided to do nursing, guess what school I ended up going to at that point? Because I was already working as a nurse. So, it was crazy. I ended up going to the University of Miami after all for school. So I just encourage anybody that is willing to listen to my story that, a lot of times you see people in whatever position, you have no idea like how they got there. But I definitely had humble beginnings. Even now, I have a scholarship at UCF that is specific to students pursuing mental health, because I just felt so strongly about all the people that invested in me, that I wanted to do the same. So staying hungry, staying humble, and just, giving back. So.
Lovely. What a lovely, wonderful story. And obviously, I'm certain that your mom was incredibly proud of you and, saw the trajectory, and the fact that you landed in nursing, I'm sure was something that she deeply appreciated. I'll also mention I was at the University of Florida at Gainesville as a chair for 4 years.
Awesome.
And absolutely loved it. So yes, go Gators. So let's talk a little bit about the University of Florida, because that was your undergraduate experience.
Yes.
What was your major? What was your experience like? Tell me a little bit about that time.
So this is little me, growing up in Miami, never went anywhere else other than in my little circle of Miami, never experienced anything. So it's really scary to move away to go to college. But my parents were very supportive of it, because we knew that they have a thing called preview. So you get to go for a weekend and experience what it is to be like on campus. Your parents come with you. They have different workshops and stuff like that. So that was very, very helpful. So, and I also had other friends that went to University of Florida as well when I was in high school. So that kind of helped, but it was scary because you hear all these horror stories of what they think that area is like. And it wasn't like that at all when I got there. It really felt like a community. And I honestly, even just as a person of color, I mean, I had classes where I was the only person of color in the class. But I definitely felt that the professors were very supportive and always encouraged me along. And the same thing, even when I went to University of Central Florida. I think sometimes depending on what field you go into, like mental health, I think it's getting more attention now than it did before. But depending on what your area of interest in, so my area was, schizophrenia, spectrum disorders. So it's like you get into these different areas where you're like, I'm looking around, I'm like, there's no one that looks like me. There's no females in this group or whatever, but you end up not really caring much because you're just so passionate about what it is that you are working on. But I loved my experiences at UF. It formed a lot of who I am today. I went to UF, I studied health education and behavior, and I minored in gerontology. And it's funny because years later, now I wrote a textbook on a geropsychiatry practice, which was really cool. And then they had a combined degree program, which is so funny. So my family is Jamaican. So they sent a letter to my family in Miami, to my mom, saying, hey, your daughter qualifies for a combined degree program. And so my mom calls me and she's like, you're going for your master's degree. I said, what? I don't even know what a master's is. But the program allowed me to finish my bachelor's degree in 3 years and then 1 additional year to finish my master's degree. So I ended up being a graduate with in health education behavior with both my bachelor's and my master's. And I literally, when I graduated, I'm Googling jobs with a master's degree because I had no idea. And that's how I got my first start in education, because I found a job working as an instructor for University of Phoenix. And that was way back when, before, online education was popular. So I like to think of myself as, one of those beginners in the online teaching world. And then I went into University of Miami, did nursing, graduated, all of that, worked as a nurse. And then I came back to University of Florida and did my master's in psych mental health. So I got my degree as a nurse practitioner there. And then I went and got my doctor of nursing practice from the University of North Florida. And then I got my PhD from the University of Central Florida. So I feel like I've gone to almost all of the public universities that are in Florida, but also the University of Miami was private as well. So I had a great experience. I would say that one of the things with going to school is just you have to kind of just jump in there and go. And utilize the resources that the university already has. So some of my lifelong friends that I had at the University of Florida, I still speak to, and we all had those same experiences, whether we were roommates, whether we were classmates. It was great to have that experience together and to share what we went through together as well. And even now, even years later, we still can share those experiences, even if we're not doing the exact same things.
Sure. It sounds like among many other exceptional attributes that your mom was also a good mentor and advocate. I love the story where she calls you and says, "You're getting your master's." That's very sound advice. And then you obviously had the wherewithal to pull it together. Marie, let me ask you this. There are a lot of young people out there, people of all ages, that might be asking themselves, should I go to college? Is that worth the investment of time, the investment of real money? If you were to give them one piece of advice about that worth and whether they should do it and how to succeed, what would that be?
Absolutely. Absolutely. You might not go as far and be overachiever like I ended up with all these degrees. But even my husband, he's a motorsports photographer for NASCAR, and he has his master's degree as well. And he is not he's just not a college type of guy. He's like, if I don't have to do it. And he would say the same thing. We spoke to high schoolers before together, actually, about our journeys. And he would say nowadays, even just to be like a photographer, they'll put, okay, you bachelor's degree, or to be an instructor, master's degree. I have a childhood friend that would say, "Oh, Marie, you're so recession proof." And I would say that because a lot of the jobs that you're applying for, they want to see, it's like it levels the playing field. So whether you're like, I don't really want to go, you can even go to a vocational school and get a certificate. You can go to a vocational school and get your AA degree as a start. And that's exactly what my husband did. He got in photography technology. Then he went on and got his bachelor's degree in photography. And wow, to have a career as a motorsports photographer for NASCAR, that's pretty cool, right? So I would say that it's absolutely worth it. And even my friends that I might have met in EMT school that were like, okay, I'm just gonna get a certificate in EMT. They all ended up going back to school. So I would say do it now while you're young, you're energetic, because you might end up doing it anyway when you get older. So you might as well just do it now and cash in on that income now rather than waiting much later to still do it. So absolutely worth going for a degree and getting that college degree. Absolutely.
So thank you so much. I want to thank Dr. Smith East for spending some time with us and sharing her story and the exceptional work that she's doing. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. We'll see you next time on Public Health America. Take care.